Arkansas. Did you know that March is National Nutrition Month, and the theme this year is Savor the Flavor of Eating Right? We have Joe Salyer here. He's a dietitian at CHI St. Vincent here to share us the new guidelines, and they're different in some cases. And so what have they been over the past few years, these guidelines? First of all, welcome to the show. But
Thank you.
These guidelines, they come and they change. We thought we were doing everything right. Maybe we were, maybe we weren't. But what were the old guidelines?
Well, starting in 1980, they came out with this dietary guidelines, and every 5 years they revise it. And so the U.S. Department of Agriculture and the U.S. Department of Health and Human Services, they put together a council of physicians and dietitians and scientists, and what they do is they go through and review all the latest literature, and they come up with these findings that support reduce disease rates and improve health, and they assemble it and give it to us.
And the new guidelines came out when?
This last round was 2015 to 2020.
Okay.
And so they came out last fall, this last winter, I think.
Okay.
Yeah.
And what are they here? You brought a plate full of what I assume is what we need in a day, an average meal of some sort?
Well, sort of. What we're looking at here is the USDA's My Plate. Remember the old food guide pyramid?
Yes.
It was
It had cake at the very top.
Yeah, and the tiny little triangle at the very top.
Right.
So we've gone away from that. It's hard to get rid of it, but people just still reference it. But now we're doing My Plate, and this is kind of an easy way to sort of assemble a meal without getting too bogged down by the details. And so what we're looking at is you're basically divided into 4 quadrants, and you're looking at 40% vegetables, 30% grains, 20% protein, and 10% fruit. Okay. And this is a good balanced way to assemble a plate.
And this is should be a dinner, one helping of this.
Yes.
Okay.
Yes.
And you brought a glass of skim milk?
Yeah, and so we've got the 4 quadrants on the plate, and then we've also got a space now for dairy. And what's important about with your dairy choices is kind of going back to what the new guidelines are, is that we're looking to reduce saturated fat. The old emphasis used to be on limiting cholesterol. Mm-hmm. And they thought that cholesterol in your diet is what caused you to have high blood cholesterol. Well, now we're finding out that it's more related to the saturated fat content and not so much the cholesterol.
Okay.
Because eggs had a bad rap for a long time because they've got a lot of cholesterol. But now we're finding that it's more related to the saturated fats. Yes. And so we're looking to make sure that our diets contain 10% or less by calories of saturated fat.
Okay.
Yes.
And you want to limit the added sugar that you have that's in so much of the food that we eat.
Yes. So again, the 10%. So we're looking at 10% or less of your daily calories should come from added sugar. So an example of that would be a regular cola or a regular soda. That's got about 40 grams of carbohydrate in it, which as part of a 2,000 calorie diet, that's almost 10% right there. And so you're thinking, well, maybe I'll make a better choice and go with juice. Well, if you do the same serving size of juice, it's also about 30 to 40 grams of carbs.
So 12 ounces of cola, soda, is about the equivalent almost to orange juice, to 12 ounces of orange juice.
Right, and so what we're wanting to do is move away from added sugars and refined things and go more towards whole foods. So a better solution would just be to eat an orange. One medium orange is about 15 grams of carbs, and you're going to get fiber and other vitamins and minerals you wouldn't normally get if you're just drinking the juice.
Okay, so now you know.
Now you know.
Or you can just squeeze the juice out of the orange yourself.
And you get some physical activity at it
while you're at it. Physical activity while you're there. You go. Or you can get a machine to do it for you. That's the way we do it these days. And if we have any questions about the new dietary guidelines, you guys are available?
We are. Dietitians would love to speak to you if you're wanting some information. We'd rather you come to us than go to the internet. Mm-hmm. So go look at www.choosemyplate.com.
All right. And we were talking a little bit about the skim milk. You suggest that over the whole milk any day, and that's because of the saturated fats?
Exactly. So just reduction in saturated fat. And if you're looking for dairy sources, you're wanting to look for the low-fat variety, so 1% and skim milk.
So eggs, good?
To an extent.
To an extent?
They've still got saturated fat in them.
But they're not as bad as we thought they were.
Right, so you're not going to get a jail-free card to eat all the eggs you want, but you can still include them in your diet, but just be mindful of that saturated fat number.
So if I eat 3 a day?
Maybe a little less.
But I work out a lot? Take the egg yolk out?
There you go.
Okay, I finally found some common ground. Great to have you on the show. Thank you very much. All right, so there you have it. If you have any questions, let them know over there at CHI St. Vincent with our dietitian. Stay with us. Coming up after the break, we're going to have a short one here, and we're going to find